Welcome to Sex Education. Today, we will talk about the pros and cons of long-acting reversible contraception, also known as LARC. For more information about what LARC is, how it works, and the different types of it, please see our other video. One of the best things about LARC is that it works very well at preventing pregnancy for multiple years after it's put in. This means that you don't have to worry about remembering to take a medication every day, put on a patch every week, or return to see a doctor for a shot every few months. It can be freeing to not have to wonder about whether you might be pregnant if you don't choose to be. Another good thing about LARC is that it can be removed at any time so that those who decide that they want to get pregnant can do so whenever they choose. In other words, LARC makes the default not being pregnant, but when you decide that you're ready to have a baby, it's a simple default to change. Another pro of LARC is that the implant and the hormonal IUD have a very low dose of only one hormone similar to progesterone in them, which is naturally found in the female body. This makes it a good option for women who have medical problems in which they can't be on birth control with estrogen in it, which is another hormone found in the body. Finally, the copper IUD doesn't have any hormone in it at all, which is a good option for people who want a hormone-free, effective birth control alternative. There are some cons of LARC as well. One of these cons is that all forms of LARC require a procedure to be done in order for them to be put in. To see more details about these procedures, please see our other video. Needing a procedure means that you will have to go to a healthcare provider who is able to do this, which can take time and planning. Also, just like any procedure, there are some risks to putting in LARC. For example, when having the implant placed, you might get pain, bruising, or infection at the site of the implant. Although these risks are not very common, they do sometimes happen. Your healthcare provider can talk to you more about this as well. Another con of LARC is that it can cause random or heavy spotting or bleeding. This is especially true with the implant and copper IUD. Sometimes this might get better on its own after a few months, and there are also some medications that you can take that might be able to help as well. The IUD that has hormone in it more often causes lighter bleeding or even no bleeding at all, which can be seen as a positive or a negative. In some people, the implant and hormonal IUD can cause other side effects as well, such as mood changes, headaches, dizziness, nausea, skin changes or acne, weight changes, back pain, stomach pain, and cramping. It's hard to know which, if any, of these side effects will happen to each person because everybody is different, but if you get any of them, you should talk to your healthcare provider about all of your options. Even though this video is meant to provide general education about LARC, it does not replace the guidance and recommendations of your healthcare provider. If you are interested or have any questions about LARC or any other form of birth control, please reach out to them to learn more about which options would work best for you. Thank you so much for watching.